Welcome, everybody. I'm Melissa Runge-Morris, Director of the Cures Center, and it's my pleasure to introduce Dr. Carrie Leach, our lead speaker today in our integrative seminar series with CLEAR. Carrie is joined by her colleagues, members of the Cures Community Engagement Core Advisory Board, or what we frequently refer to as the CAB. A little bit of background. Carrie is an exemplary leader, and she serves as co-leader of the Cures Community Engagement Core. And what this means is Carrie is really responsible for putting Wayne State's Community Engagement Core for our Environmental Health Sciences Core Center on the map nationally. She is well respected and looked to as an authority from the family of environmental health sciences core centers funded by NIEHS across the nation. And her career development at Wayne State University, in my estimation, has been meteoric. Carrie received her PhD degree from Wayne State University in health communications, and she became, subsequent to that, a faculty member. She's a research assistant professor in the Institute of Gerontology, IOG, at Wayne State University. But Carrie wears many hats. She serves on a number of very important advisory boards. Just to name one, she is Associate Center Director for Community Inclusion, Community Engaged Collaborative for Promotion of Access to Technology and Health in the Division of Research and Innovation at Wayne State. And because of her expertise in the science of community engagement, Carrie is a factor in many of the community engagement initiatives that are across our campus and even with our sister institutions. Today is a very special day because we get a chance to hear from Carrie and her very passionate and committed Community Advisory Board team. We know as environmental health scientists that without the community, there's really no receiving end to all the things we learn about environmental health in the research laboratory. The community we serve are our patients. And I think it's a great privilege for all of us to hear from Carrie, who's been publishing new best practices, data, and information for all of us to use in this exciting and ever-changing field as we as scientists get to understand and learn from Carrie and her team. So let's get the show on the road. Carrie, I don't want to speak and use up all your time. I really welcome your presentation today.
Thank you so much, Melissa, and thanks for allowing us to take up this space and speak to everybody that attends these seminars. As someone that has been attending these for years and years and years, it's exciting to be in this room with everyone. So thanks for making time today, not only for myself, but also for my partners and collaborators, Deb and Dell and Sandra. And I have a few slides I want to share so I can talk about them more in depth. So I will go ahead and get started and share my screen and slides. And thanks, Lynn, for all of your help getting us here together today. Let me go back. So what are we talking about? We are going to give a presentation on centering community experts in research. In this context, it's environmental health. And obviously, my three co-presenters here are experts in community and environmental health and the experience of living in Detroit. But I'm going to talk about this work across the community engagement continuum. So what does that mean? That there are deeper and broader, more shallow, more partnered, all kinds of different engagement, and there's not one that's better than the others. It really depends on what your goals are. So myself and Dell and Sandra and Deborah are going to talk about some of those different different approaches so that you can start to see yourself in how you might engage community in your own research. That's really our goal today, is to encourage people to be part of these processes, and that we offer ourselves as supporters of that work and resources to you if you're interested in doing this kind of work. So that is a picture of the four of us. We gave a talk not too long ago, and so I'm glad to have that picture of us. Nothing makes me happier. The reason I asked if we could do this presentation today virtually is so that we can archive this for presentation in the future. So one of the things that we do as a community engagement core is make sure that we don't just reach people that could make it the day of, but we know that this will live on and have a longer life through dissemination and other modes and transfer of knowledge in other ways, including through our Cures YouTube channel. So thanks for Lynn for allowing us to do this virtually to the benefit of others that can't be here with us today. So the goals of our talk today are to identify the dynamics that contribute to successful engagement. You're going to hear the stories in the words of the people that I collaborate with. Instead of me telling the story, I think it's better coming from them. And also discuss the challenges, because it doesn't always go right. Sometimes it goes wrong, and you learn from that too. And that there's always, my favorite part about it are the mutually beneficial outcomes. I consider all of my community advisory board members and partners in research that I do across our campus and nation to be teachers of mine. And so I learn, I hope they learn, we all learn together. That's the goal. And we want to build your capacity to engage in case you want to get involved with research. We want to give you not only some of the content that are in these slides, but I'm also going to point you to resources in the slides that will be made available and in this video, so that if you need tools to engage community experts, you can do that as well. So Melissa gave you a shtick about me, so I won't do that again. I would just say one of my proudest moments and being at Wayne State University since 2008 is helping Wayne State become a designated age-friendly university. We are part of a global network, and my heart really is working with populations that are 65 and older. Obviously, I'm at the Institute of Gerontology, but and do my work, even environmental health science, because I believe that people that are 65 and older have more capacity to be able to disseminate and raise up other groups with knowledge that they share. And also a founding member of the Gerontological Society of America Community Engaged Research Interest Group, one of my proudest accomplishments. So Sandra, none of these slides will do these women justice. Let me just say that first and foremost. Sandra Turner Handy wears a lot of hats, has had a long career in environmental health, advocacy, and justice. She is interim director of Detroiters Working for Environmental Justice. She's executive director of Denby Neighborhood Alliance in her own neighborhood. We had an event, a Cures chat there not so long ago, and Sandra was wonderful to welcome us there, and we were well received. And she has been a very long-standing community advisory board member, and currently is the co-chair of our Cures Advisory Board. So you'll hear the story about Sandra and I's work together as we go on. Dell Stubblefield, a lot more than what's on the slides too. She's had a long, flourishing life. I've learned a lot about Dell, including where she was born in Black Bottom, Detroit, and the story she tells about why it was called Black Bottom, because the soil was so rich in that area, and the gardening and kind of urban farming they were doing before it was trendy. And she currently lives in Hope Village, and she is a community engagement specialist at Hope Village Revitalization. And that's an organization that I just really have a big heart for, and Dell's work there. She's also been awarded the Civic and Community Leadership Award for the 70 over 70 at the Hannon Center, a longstanding community advisory board member and senior advocate. And I would say Dell and I have had 10 years of learning and experience working on projects from environmental to digital health. So we have a story that tells, that community engagement isn't always linear. It's not always a straight path, but that we learn as we go and evolve and grow in lots of different ways. So you hear all about Dell and the work that we do together as well. Finally, my newest collaborator and partner that I'm so grateful for that also has a very long resume that I won't share. Deborah Stewart Anderson is an executive director of Zero Waste Detroit. She has been very immersed. I first came to get to know Deborah as part of the Michigan Environmental Council and through Sandra and other colleagues there. She has a broad span of work that she does, great background in instructional and expertise in instructional design. She is a Cures Community Advisory Board member. And I would say Deborah has a very unique story to tell in that she came to Cures, the Community Engagement Corps, approached myself. We asked, pleaded with Dr. Chris Chanacosta, please join us for a few projects she's going to talk about. But this is very unique in that Deborah really is the person that came to the Cures and said, this is a research track we need to focus on, and let's go on it this tour together. So she's going to share that story about her work as well. So I just want to tell you a little bit about this title. We are talking about engaging community experts across the community engagement continuum. What does that mean? That there are lots of different ways that you can engage people, and they're all important and have meaning and use for different projects. So you'll hear Dell and Sandra talk a little bit about being consulted, involving. We do a lot of work that also is outreach, where it's just unidirectional, and there's value in that too. For instance, during the pandemic, Dell asked us to have a telephone outreach call with her neighborhood about stress, and you'll hear about that. And that was just a one-way communication, but that's what they needed at that time. And so you'll also hear stories about consultation and involvement. And then we'll get to Sandra and Deborah, where we're moving across the continuum, where you have this increased level of closeness, communication, impact of your work. And that is done through close collaboration and co-leading. And so I've done a little bit of with all three of my esteemed colleagues here today across this continuum. But I wanted you to have this slide because we will archive it and as a resource. And you'll see that the different ways in this model that community engagement can be done. And I also have principles here. I don't want to go through this because I really want my partners to be able to spend the time during our seminar talking about their stories and their experiences so we can learn. But this is also resources I want our attendees to have. And there's also references at the end in case you need handbooks, instruction. And I'm always a resource for anything you might need related to involving community experts in your research. So please reach out to me if I can help support and facilitate that work. And so I think you've heard enough from me, but you'll see in this model again, the points that Dell's going to touch on in her slides, and the points and the projects that Sandra will be talking about. And all of these individuals, I'm just grateful for the time that they have taken, not only to be co-mentors, co-teachers, and also friends to me. I share this space with great respect, and I just appreciate that they are taking the time out of their days and weeks and all the emails we've sent and iterations of this presentation, and that they are here to tell the stories themselves. So first, I'm going to hand it over to my community expert collaborator, Miss Dell Stubblefield.
Thank you, Carrie. Good afternoon. My name is Dell Stubblefield. I'm a lifelong resident of Detroit, and as I often say, a seasoned senior citizen. I was blessed to be born to parents in the historic Black Bottom community where family and neighbors were important. It was there that I witnessed their deep involvement in church, school, and neighborhood life. Looking back, I now feel that this is where the seeds of my own community engagement were planted. Although I have had various professional experiences throughout my life, it was later in adulthood that I truly discovered my passion for community work. A pivotal moment in that journey came in 2014 when I joined the Cures Center for Urban Responses to Environmental Stressors, Community Advisory Board as a senior representative. In the beginning, as a CAB member, I often felt I had stepped into the wrong room. The information being shared felt overwhelming, and I struggled to connect. At times, I even considered leaving. However, when I found the courage to express my feelings, I was met with encouragement and support from individuals both within and outside of the group, and I chose to stay. And that decision became one of the most meaningful of my professional life. It opened the door to strong university partnerships and expanded my ability to serve my community more effectively. And today, I hesitate to think, where would I be in my growth as a community advocate if Cures had never existed? Currently, I serve as a community engagement specialist with Hope Village Revitalization, a community-led nonprofit serving a 125-block area near Focus Hope, a long-established and respected institution in Detroit. Through my work, I have frequently partnered with Cures to access valuable resources addressing community concerns. For example, when a concrete crushing company sought to operate within our neighborhood, I reached out to members of Cures. They equipped us with research-based guidance and critical information that empowered our residents to successfully block that effort. The outcome was not only successful advocacy in our own neighborhood, but also we got the ability to share knowledge and strategy with other communities facing similar challenges. These outcomes demonstrate that when universities and communities work together, research becomes practical, accessible, and transformative. This is the true power of a university-community partnership. Knowledge shared becomes strengthened communities. During the COVID-19 pandemic, I became deeply aware of the isolation, stress, and loneliness that many residents, especially seniors, were experiencing. In response, Hope Village Revitalization launched a monthly neighborhood call to provide information, share concerns, and connect residents with essential resources. During that time, Cures once again demonstrated its value by participating in those calls and providing expert guidance on managing stress during uniquely difficult circumstances. Our monthly neighborhood calls, which we still hold, provided consistent engagement for residents. Participation in the calls has grown steadily, and many seniors report feeling more informed, connected, and empowered to seek available services. Over the years, I have been humbled to receive recognition for my work, including the 70 over 70 Community Leadership Award. While I am grateful for the acknowledgement, what matters most to me is the impact of my work. Through community engagement, my participation with Cures, and the relationship forged between university and community, I have been privileged to help improve many lives. I am especially proud of encouraging seniors to try to increase their involvement in volunteerism, participate in research initiatives to gain information and have a voice in the process, and to grow in their use of technology for improved digital literacy among adults, increasing their ability to stay in touch with family and friends, have entertainment options, access to virtual resources, and connect with important health information. I believe the university community partnerships can produce tangible and measurable outcomes. Looking ahead, I envision even deeper collaboration between universities and community leaders. My hope is to see increased intentional engagement of seniors as active partners in research, design, and implementation. Expanded environmental health education delivered directly within neighborhoods. Greater access to technology training that enables residents to participate in virtual forums and research initiatives, structured mentorship pathways, connecting university students with community elders for shared learning and ongoing two-way communication where research findings are consistently returned to the community in understandable and actionable formats. As someone who once questioned whether I belonged in a university setting, I now understand that community voices are not only welcome, but they are essential. The continued strengthening of these relationships ensures that academic research remains grounded in lived experiences and that communities benefit directly from institutional expertise. My commitment moving forward is to continue encouraging seniors and residents to stay engaged, stay informed, and keep it moving. Together, we can build partnerships that do not simply respond to challenges, but proactively improve the health, resilience, and well-being of our communities. I am grateful for the lessons learned from my parents, for the opportunities provided through university partnerships, and for the continued growth that comes from staying open to learning. In my advocacy for seniors, I often emphasize the importance of self-care, embracing new ideas, and committing to long life growth. My goal is not simply to live long, but to live well and to help others do the same along the way. Thank you.
Thank you, Dell. So well said. I appreciate you covering a wide range of our work together, and also just want to acknowledge this. The story also isn't just about Carrie and Dell and the work we've done together, but also on the call, the person that delivered that call in her neighborhood was Dr. Chris Trinacosta. Some of the concrete crushing and involvement there was our community engagement core, including Professor Nick Schreck, who worked with our environmental law students to support the neighborhood. There's a lot of resources to bring to bear in support of Dell and Hope Village. And so I thank you for calling all that out, Dell, and thank you for that. And next we are going to have Sandra Turner Handy, and I turn it over to you.
Good afternoon, everyone. Dale, excellent presentation. It's so hard to follow Dale because to come behind her, the very big shoes to fill because her experience in the city of Detroit has been long and has been really built a foundation how we do engagement and outreach in the city and how we as advocates and activists really work in order to make sure that the voices of our residents in the city are uplifted, but more importantly, are being heard by those in decision-making capacity. You know, as a member of the Cures team, I understand that in all of the work I have done around that involves engagement around environmental issues since 1998 have really been founded on research and numbers and ideas that are coming from researchers across our state, and more closely with me, it's our researchers at Wayne State. And one of the things that I say all the time is that when we go before legislators or go before decision makers, normally it's the research that we take with us. We show them the numbers that really tell them how the quantitative impact that different environmental issues may have on our community and our community members. But being able to work with cures and understand their researchers and the need for our community members to engage and tell the story. Let's put a story behind the numbers. Let's put the story behind the numbers that tell about the MD on the ground personal impact that a lot of the environmental issues that we're dealing with in the city of Detroit is having on our residents. So that has been just a long-standing goal of mine, starting with the lead issue in our city and the number of kids that were lead poisoned, and watching them go through a series of having now cognitive issues that'll never be resolved for them. And understanding that, and understanding how the mothers may not know that you have to have these kids tested. How do we engage and get that information out to them? That's what's important. Working around the can flow issue, which was the issue of a industry that was supposed to take toxins out of wastewater and dispose of it properly, that was dumping it down in the sewer system in one of our low-income communities in the city. And those residents not knowing how to engage, how to uplift, and how to voice their concerns were living with this on a day-to-day basis because they were dumping water in the sewer system, and it was coming up in the basements of the homes in that area where babies were on breathing machines at 1 and 2 years old. Being able to engage around that type of work and help our residents to understand that they have a voice, that they can engage, that they can uplift that voice, and that voice can be a major factor in decision making that is impacting their everyday lives. We always talk about our natural environment. And for a long time, I thought people that advocated on environmental issues were tree huggers, until I began to understand that not only our natural environment, but our built environment impacts our lives, and that we as residents have to learn how to tell our story. So working with cures has allowed me to be able to tell the stories of can flow, where we had to go in and fight with the state to get the state to shut down this facility that was poisoning so many people in the community. So the ability to advocate around that. And then everyone knows I talk about advocating around the incinerator and how we had to talk with different deputy mayors in the city of Detroit just to get recycling in the city in order to reduce the amount of solid waste that was going into the incinerator and polluting our environment around there. I'm the one that tells the story. I put the story behind the high asthma rates in that area, that the state produced this report every year. And of course, that was the area where the asthma rates and respiratory rates were the highest. I put the story behind it of my granddaughter being one of those people that 14 years old, cheerleader, healthy young lady, goes to school right across the freeway from the incinerator, wind up with asthma, spending more days in children's hospital emergency room than in school. 14 years old, graduates, move away from that area. And she is now 33 years old and not used the inhaler since she left that school. That's how you tell the story of the impacts that different environmental issues have on our residents, and our being able to assist our residents in being able to tell their stories and match it to the research that's being done is what it's all about, because then we can make change in our community. So when we talk about me being able to, and I'm so honored to be able to be the co-chair with Cures and on the cab, allows me to really make sure that all of our cab members, have the same opportunities to tell the stories, to bring the stories to the table, to bring things just like you're going to hear from Deborah, these research ideas that are needed in our community and how we take that and push it up the ladder. That's engagement. That's being able to actually work closely with researchers around issues that we bring to the table or that we feel is important in our lives. And to be able to be the co-chair of a team that really pushes involvement of our cab members and the people that they represent in the city is just an honor for me. To be able to collaborate through, you know, looking with researchers, but steady with our community and our cab members and being able to bring those people together. And when we do policy advocacy, being able to put those numbers and that research behind it, but also, like I keep saying, tell the story, make it a full package so that people understand that these numbers do truly impact the quality of life of all of our residents across the city of Detroit. So it has just been such an honor for me to be able to engage around issues like lead and the incinerator and bringing recycling to the city and looking at how the built environment really impacts our lives in the city of Detroit. And because of the fact that if you're living in an area where the built environment is vacant land, dumping in your city, then that impacts the stress and the feeling of being committed and involved in your community. That impacts those feelings to where residents, they leave. They want to leave. They don't want to live in a community that looks the way it looks if it's not raising their quality of life. So I'm constantly saying to the team, and I say it to the residents, we need to tell the story and connect it to the research so that people begin to really understand how important it is to engage, to get residents involved, to be involved yourself, and to be able to collaborate across a spectrum on the issues that are truly impacting the quality of life of residents here in the city of Detroit. Thank you, guys.
Thanks so much, Sandra. I feel like I want to do a mic drop for that too. But I do just want to call out something that Sandra said, that we have been working to make our researchers more accessible. And I really do think that Sandra's involvement, especially as the co-chair, I've learned a lot from her. We've changed a lot of the process, how we facilitate meetings, who we're sharing the microphone with. But that our community advisory board meetings, we hope the goal is that people will raise the questions in their hand and feel like they can walk through a door where they're welcome with their own research questions, and that she has been part of the process for building a foundation for that to happen. So thank you so much for not only the presentation, but everything you do. If you don't know what a co-chair does, yes, it leads the meetings, the agenda, what gets talked about, what we're presenting about, the facilitation and all that. But Sandra and Melissa, our Cures Community Advisory Board member co-chairs, are part of our monthly meetings. We don't do or make decisions on our team without their voice in that process. We have one meeting every single month as a team, and they are always present for those meetings. So any event that we're doing, materials that we're developing, those really are done as truly as we can with their voice and partnership with them to our very best. Also, based on their capacities, because they have a lot of competing priorities as well. But we're just so grateful for all their contributions. So thank you for that, Sandra, and being involved in across our course, including attending our leadership meetings that Melissa Rangi Morris leads, and Sandra being able to move and decide where she sits on that agenda, and Kira's making that happen, hearing the needs and then meeting them. So thank you so much again. Next, we have Miss Deborah Stewart Anderson, and she's going to talk about her own initiatives and how she has forged a path for community-based participatory research in Wayne State, based on some issues that were happening. And I put this storyline here from Planet Detroit because Deborah was quoted in that article. So this is very recent, but when she came and approached me about this issue, I had read about the kinds of things she was talking about on the east side of Detroit. My family's from the west side, Evergreen and Tireman area. So I'm less familiar with the east side, but when she came to me, I had read what was happening and the Detroit News and other outlets that when she approached us. I also just want to call out our other community advisory board member, Kathleen Sloniger, who has shared this Asthma Capitals report with us. This is a national document. You can see that Detroit is featured on the cover. We are the #1 asthma capital in 2025. And I put that report up there to call attention to the kinds of issues that end up affecting people from the kind of issues that Deborah's going to talk about in our project. So, Miss Deborah, please take it over from here, and I can advance the slide for your flyer whenever you are ready, ma'am.
Thank you so very much, Dr. Leach, and good afternoon, everyone. I would like to thank Dell and Sandra for that wonderful opening, and all I have to do is just step right in. So thank you, ladies. I want to start by just telling you a little bit about myself. I'm a native Detroiter. I'm a product of the Detroit Public Schools, two-time graduate of Wayne State. I have been working with Wayne State for a while, a little bit over 10 years, and it actually started out with some work that I did with Dr. Haley Thompson in the co-program. We started out with the CAC, which was the Cancer Action Groups, and my particular group, which was on the east side, was the inaugural group, and several groups have grown out of that. As a matter of fact, they put us in retirement in the end of last year. But that was the Connor Creek. I was with the Connor Creek. I've done some work with Dr. Haley with Checkup, but she is really the one that kind of like wet my whistle for research, I should say, because while a grad student at Wayne State, I became interested in research because I had to take a lot of statistics classes, wasn't that much fun. But I said, oh man, this is some powerful stuff. So when I got a chance to learn more by working with Dr. Haley on her projects, that kind of gave me the courage to seek out. But basically, I am a community person. I started my community work in high school. That was during the time when, you had civics and you learned about your community and you had pride. And I lived in a community that really wasn't, it was a poor community, but you would never have known it because people took pride in community. So that has always followed me. I worked with Sandra. She brought me into Zero Waste Detroit as a part of MEC. I kind of took over that organization, and what we were doing there is partnering with the city of Detroit. Like Sandra said, we had shut down the incinerator, so we were doing education and outreach to the community around recycling and other waste diversion efforts. So that really wet my whistle for the engagement piece around environment. So as I continued to do this work. We ended our relationship with the city in 2023. I got this email. Don't know where this email came from. Don't even know why I got it because it was around air quality. And I'm saying to myself, I was like, oh, okay, we don't really work. That wasn't really one of our arenas. So, but I couldn't get it out of my mind. It's like you can do some benefit. And I started thinking about the Stellantis plant. I started thinking about Southwest Detroit. And I just started thinking about the overall problem that we had in the city of Detroit around pollution. So I says, I'm going to go ahead and I'm going to apply for this. It was through the RISE program, which that's the Research Innovations Using Sensor Technology in Environmental Justice Communities. It came from the University of Cincinnati. Like I said, I have no idea why they sent it to Zero Waste Detroit, but I looked at it and it was an opportunity to learn about air quality, to get free air monitors to set up around the city. So I completed the application and they accepted us. Then comes the problem with, oh my God, I got to find somebody in academia to work with me on this. So I have been working with Carrie for a while. She's the first person I thought of. I just drafted an email and I was like, Carrie, take a look at this. I was wondering if you and maybe you can get somebody else, one of your colleagues, let's go to Cincinnati and let's learn about this and bring this back to our community. So she, as usual, she does not know how to say no. She says, sure, Deborah, I'll help you. So she starts to spread the word. Before I knew it, she had pulled in Dr. Trina Costa. She had pulled in Dr. Stephen, who's over the Phoenix program. And she had talked to some other folks on a meeting from Henry Ford, and she'd actually pulled them into the mix. So I'm saying this is great. So we've been working together since 2024. Carrie did not get a chance to go with us. She got ill to Cincinnati, so it was just Chris and I. We went through the 2 or 3 day training. We got our purple air monitors and we bought them back. So once Carrie started working on everything, we put together this great team. That's where the collaboration really came in. And they said, well, this is a good project. Why don't we try to apply for some more money? Because there was no money connected to the University of Cincinnati project. So lo and behold, we did the NIH grant through Cures with the help of a great team, and we were able to secure $60,000 to push our project forward. Now, Dr. Ike over at Henry Ford, who is really, really a dynamite community thoracic surgeon who just loves his community, he took the ball and he started to run with it. We only had the 10 monitors. He says, well, why don't we buy 20 more monitors and we'll have 30. And I was trying to focus around the Stellantis plant and around the Eastside, but I felt a little constrained with that because I knew my whole community is Detroit. And I know that my whole community suffered from bad air, asthma, and other diseases. So I kind of wanted to spread them out. And sure enough, teamwork is just marvelous. And what you can do with a good team is just, I mean, words can just not explain. So we started to move on our project. Uh, we actually ran into a problem because we had to order these 20 air monitors from Taiwan, I believe it was, Carrie. And we had to pay this big tariff fee. So now we only had so much money. So what happened was, of course, Henry Ford, they took up the mantle and they paid that, and we finally did get the air monitors in. So as we're going through this, we're thinking, okay, we engaged a core of community organizations. We call them the CARE team. They came in, we had several meetings, and we talked about how we could roll this out. And as you can see on the flyer, Just Air is also one of our partners who is helping us to network all of these monitors, because what we found out, okay, we have now 27 monitors that we have put up around the city, but Wayne County has monitors, City of Detroit has monitors, and Just Air has been one of the organizations that have been linking these different sensors together. So Dr. Stephen, he introduced the Phoenix, and I'm like, wow. He's like, this is what we can do with this. These are the overlays we can overlay for different diseases in different areas. We can look at the air, the air pollution, the what do you call those things? The per, per whatever ppms, I think. So we were off and running as we worked. Carrie kept coming. She kept mentioning, now, Deb, we got to, this is a community project. We got to get more. And I was like, right, I just don't feel right about this because we're not really have boots on the ground, as they say out there, with our community partners. So we came up with this nice fact sheet that you see here. At first they had my picture on this fact sheet, and I'm like, no, 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 I don't want my picture on there. I says, let's make it representative of our community. So we put the hands up there. Then they had my cell phone number. I said, I can't do all this. So Dr. Ike says, okay, why don't we just leave your email address and I'll include one of my interns' telephone numbers at the hospital. And that's what he did. And this was the best, to me, idea, because Dr. Ike got some of his crew over at Henry Ford to take to the street to pass out this fact sheet. I started making calls, and lo and behold, they were doing such a great job. I started to get emails. So, long story short, the community answered our call, and they have agreed to put up monitors around the city. I still am trying to get my high school, which is Southeastern High School, that's right in the backyard of the Stellantis plant, to really come on board. We had the science teacher, he was working with us, but I kind of think we lost him. But I want to get some young people involved on this project. So I know I'm going to wrap it up here, but I wanted to say that because of our outreach efforts to the community, we were able to get folks on Van Dyke Street. We were able to get folks on Grand River to agree to put up a monitor. So the next step is for us to get all these monitors networked, have a big community meeting to explain to our community how we are going to deliver this data and how we're going to look at this data together to help with our environmental stressors. So I could say more, but we're running out of time. So I'm just, I've learned so much from everybody. And I just want to say that community engagement with academia and outreach is the new thing. So let's everybody get on board and let's get out in our communities and get some work done together. Thank you.
Thank you so much, Miss Deborah. I appreciate what you said, and I just want to call out a couple notes of even if you engage, and I think Dell also spoke to this, right? Even if you're engaging people and they're not entirely confident and sure about why they should be there, there are a lot of opportunities that come out of these places where people can step into and then figure out how to leverage the resources for good in their communities in the way that matches what their community is actually impacted by. So thank you for lifting that story and lifting the story about what it means to have Cure's resources brought to bear through the pilot pilot project through our TRSC core, including Dr. Stephen Korzeniewski, who's been great to work with. And because I have consultation meeting with each one of our Cures pilot project applicants, that's where I met Dr. Ike and Joan, who we work with at Henry Ford. They were going to submit a similar project. And I said, my community partner, Deborah, really wants to submit an application. What if we work together to do that? And it was a great opportunity for us to join forces. And I just appreciate you lifting up our partners and the work with Henry Ford as well, an important partner of Cures. Deborah left us with a few lessons too. I think she told the story about this is not a fast thing. You could ask Dell, Sandra, and Deborah that. They would all agree it takes time and it's a slow, long process. Our systems are not always compatible for their engagement, and it is challenging and takes a lot of patience. I would fully support that. And I think my job is really to manage the expectations and offer the apologies and do my best to help navigate those systems in ways that work for them. And one of my favorite things about my work and that I remain passionate about is the benefits that not only I see happens for individuals and people that I build relationships with, but that and community and all of the ways that my co-presenters talked about, but for myself and my own development and my own ability to integrate people in the work so that I can learn and I can evolve and I can become better at my job, including building the capacity of other researchers around me, because that's ultimately what I hope to do, because I know that research is a leverage for improved community health. I believe that strongly. And then finally, I would just say I think Dell and Deborah and Sandra have all told the story about how those past interactions and experiences leave and can predict future partnerships and success. And I think when you step into research at any place, it helps you figure out where you can go and the spaces that you want to be in that you might not otherwise have learned about. And that there are a lot of cross communication across our university. And some projects are siloed, and we don't get the opportunity to connect with community members that are interested, but we just lift up the work that other centers across Wayne State are doing, including our partner, our close collaborator, the Clear Center, and other centers across our university. And so I hope that you got what we hoped here is a presentation from all of us. I leave you with a few references, relevant scholarship, and I will be sure to share these slides and also the recording. And also, we do have a few minutes. I'm so glad in case people have questions for us. And sorry to turn your cameras off, but we do want to be able to share this recording in the future. So we decided to turn everybody's camera, and thanks for managing that, Lynn. Thanks, Nick.
Hello, I have a question.
Great.
Well, thank you so much, Carrie, and your team. Obviously, I learned a lot. I think this is a very fantastic because I'm basic scientist, just work in my lab, but this is really opening my eye and my mind for a lot of things. Um, my question is whether or not do we have already, or if not, anybody ever think to establish a longitudinal cohort? Just make such a focus on environmental health science, and everybody could get engaged because we have so many resources, and that could also prevent, siloed work, from different teams. Um, and this is a unique population, unique community. Uh, it deserves like a longitudinal study for years so that in the future we could in the long term, we can utilize the data and the science to build up the policy making and so forth. And I think that could be mutually beneficial, to both the academic and also the community for sure for a long time. I mean, there's so many successful examples as cohort study built up across the whole nation, I can say. But I just want to say whether or not we have a motivation locally to think about it.
So I think your question is, have we considered that? And I would say, maybe you're the perfect person to do that. Yeah, that's not something I've considered, but what I would say is I would agree with everything you're saying, but no, my job primarily is to integrate community voice and expertise into the cures across the cores and across all of the work that happens, including establishing community reviewers and working with Dr. Kosarek to have them involved in the review of the letters of intent for the pilot project program. But no, when you're talking about specific studies or longitudinal, that is not something that I have. But you know what? I think you may have brought up new directions for yourself.
Yeah, I'm just to bring up to obviously everybody in the team would be the best, to contribute such a discussion. But I think this could be a nice opportunity, and that we could serve both academic and community. Just my 2 cents right here.
I appreciate it.
Thanks.
Thank you.
And to your point, I think we could talk a little bit about future directions in that, one of the things that we discovered in the project that Deb was speaking about in our air sensors network is when we brought together individuals from across campus doing this kind of work, we realized that these sensor projects are very siloed and they're not connected in a way. So building a network of those different projects and bringing them together for collective horsepower, to your point about, leveraging things so that when you're building something, you're not just building a one-off, but that there's more greater capacity. And that was a takeaway from our project, our pilot project, about we have all of these great sensors and they're kind of being monitored in groups and not connected. And so it's something we've learned a lot about, especially me. My background is in health communication. I'm an expert in gerontology. I don't claim to be an expert in air quality monitoring, but I am an expert in helping to integrate researchers with Deborah's vision. And so that's where I sit in there, in that space.
Yeah, that's exactly my point. I think that we have so many talented people and very diligent work, but all of those I felt like largely siloed. Each team can work on one thing, but if we build up like a lump sum cohort, where we could keep recruiting and then centralize all the resources, I think that would be a really good idea. I just want to leave this for more discussion.
Thank you so much, Dr. Lip.
Thank you. I like that.
Other questions for Stell or Sandra or Deborah or myself? We welcome them. And I also just want to, Nick, I don't want to make you turn on your camera, but thanks for being here. But I do want to just acknowledge my Community Engagement Corps team members, including Professor Nick Schrock, who's at the University of Detroit Mercy. He's a dean. Thank you for being here today. A co-leader of the Community Engagement Corps with myself, as well as Dr. James Blessman, who's a key member of our team, and Rochelle Chapman, our coordinator, who makes everything that we actually do happen. Yeah.
Carrie, I would like to just tell everyone about Nick is also a great person around environmental engagement and has been doing it for a long time and on the ground, integrating voice of the people into what's going on environmentally in the city. So he could be a presenter on this panel with the rest of us because he's been doing it and doing it from a side where he's able to bring some resources as far as what the laws say, how they impact community to the table so that we really understand who we have to work with and what we have to work through in order for our voices to be truly heard.
Mm.
That's nice of you, Sandra, and you're one of my heroes, and thank you, and great job, all of you. It was a wonderful presentation. So making us look good at the Community Advisory Board and Community Engagement Course. So thank you all.
Thanks,
Thanks,
Nick.
Nick. Thanks, Nick. I think that's time. It's thank you, Dr.
Somebody has their hand up.
Oh, they do.
Oh, that's okay. Carrie, we can talk about that later. Good job, everyone. Thank you.
Thank you. All right. I don't know who I hand this meeting back over to, but I appreciate having the Cures seminar series as a way for us to tell our stories as storytellers and to have the space. So thank you, especially to Dr. Rungi Morris, who supports our work and is just a champion for everything we do. We would not be here without her leadership. So thank you, Dr. Rungi Morris. And we'll turn your meeting back over to you guys.
Thanks so much, Carrie and Deb and Dell and Sandra for doing that wonderful presentation, enlightening for everyone on this call, I believe. Look out for our next talk announcements. Those should be coming up soon. We do have a couple of weeks off for seminars. So the next one should be in the newsletter upcoming, probably next week. Thanks for coming, everybody. We'll see you next time.
Okay. And thank you, Lynn, for all your
Thanks.
work that you did. I appreciate you.
Of course, I'm happy to help.